Hi, I'm Rachel Davis. I am a nurse practitioner in Knoxville, Iowa. I own Rejuvenate RX, and today we're going to be doing PRP, which is platelet-rich plasma, and microneedling this young lady here. I started my spa about 9 months ago, but I've always had a passion for aesthetics and skin, and it's just been wonderful to follow my passion. So we'll go ahead and get started. Everyone, this is Holly, okay? And she doesn't have to say anything today, but we're gonna go ahead and clean her face and apply numbing. We always wanna do that first before we begin drawing blood, because then she can numb while you're drawing the blood and harvesting the plasma. For cleansing, I like to use water with chlorhexidine. That is already in this container. So while we're cleaning and numbing her, we're going to talk to her a little bit about what's going to happen and get her consent. So Holly, today we're going to do microneedling with PRP. And I just want to make sure that you are not pregnant or breastfeeding.
Nope.
And do you have any allergies?
Nope.
Okay. Are you sensitive to any skin products?
Nope.
Very good. Are you on antibiotics?
No.
Any other medications?
No.
Okay. Have you refrained from alcohol and ibuprofen or any blood thinners for the last 24 hours?
Yes.
Perfect. We'll allow that to air dry. There's many things that you can use for numbing. Personally, I prefer a lidocaine tetracaine mix of 23 and 7. But some people use a BLT. You'll find the one that you prefer. Looks like we're dry here. So Holly, you're going to have some redness with pinpoint bleeding during this procedure. So you are going to have some downtime. You're going to be red and healing for the next probably 7 days, okay? You may need to have some time off of work for a day or two. You won't be able to apply any makeup for 48 hours and longer if possible. So what we're going to do is use a microneedling pen that is going to create micro injuries in your skin. These micro injuries cause fibroblast and collagen production so that your skin heals stronger, and the collagen will continue to build over time. So this just gets better and better. Typically, you'll want to repeat this every 4 to 6 weeks for at least 3 sessions to get the results that you want, typically 3 to 5. And then you do maintenance every few months depending on how your skin heals, how your collagen production is. For the first few days, I'll be giving you a serum that you will apply at least twice per day. But anytime that your skin feels dry, irritated, tight, itchy, you'll want to reapply. I'm going to come just a little bit down here on your neck. You doing okay? So Holly has already signed a consent to treat, and we have went over all of the topics we just talked about prior to this also. And she did not have any more questions. Just gonna dab here. Anything in your eyes? Doing okay? Okay. So now while she is numbing, I'm going to get her blood. She would like it drawn on the other side, so I'm just going to grab that. First, I'm going to show you all this that's in this kit from Timeless Evolution. I want to make sure you always have your tray set up prior to the patient's arrival, so everything is ready to go. In your kit, you're going to have a connector for your tubes. You'll have a spinal needle. This is for harvesting the PRP. You'll have some syringes, some needles. You'll have a butterfly for collection, as well as the vacutainer. And you'll want 2 PRP tubes. You'll either want 2 or 4 because you have to balance your machine. For the purposes of PRP with microneedling on the face, 2 is sufficient. Here's the vacutainer. Open both vials. And your butterfly. Prepare the skin with an alcohol swab. So you'll want to fill this all the way to the top. It will stop on its own. Fill the second. The tubes from Timeless Evolution do have the sodium citrate and the gel so that separation is complete. They're very simple to use. Everything that you need comes in the kit. Go ahead and discontinue the butterfly. How was that? Not too bad, right? No. Okay. And once again, she can get all cozied back in. Going to gently turn the vials 5 times. And then we're going to come over here to the centrifuge. So you'll put the vials in opposite across from each other in the centrifuge to make sure that it's well balanced. Shut the lid. You're going to go up to 3,500 for 8 minutes and press start. And that begins the process. So now she's still numbing. I'm just going to clean up what I used to draw blood and get her ready. The water and chlorhexidine that I used, I only put the sponges in once and then I do not double dip them, so this is still good to use to clean off and dispose of all of this. We will be using the Timeless Evolution pen. This goes from a depth of 0.25 to 3 millimeters. This comes with the pen cartridge. It is a 12 needle cartridge. And you also get the covers for that. So microneedling creates those injuries in the skin and causes fibroblast production, collagen production, and stimulates stronger, healthier skin. It can help with dark spots, acne, scarring, brightening, and shrinks pores. So we'll move that water back over and open our 4x4s. This will be for cleaning the face to get all of the numbing medication off. So whenever the blood comes out, it will be separated. At that time, there'll still be platelet poor plasma in there. So we will extract that, and then we will, again, run it through the centrifuge at a slow spin to get the most pure platelet-rich plasma that we can. Then we will harvest that. They will be harvested in 2 5 ml syringes, which we will add a small amount of the DRS hydrating serum, which is pure hyaluronic acid. So the pen is wireless, so you don't have a funky wire trying to, while you're trying to needle. These come pre-packaged individually. Just open the end and slide your pen in. I just opened it a little too far, but we'll just pull it back up and re-secure it. The needle cartridge, this end goes into the pen, like so. And it easily twists on until you meet no resistance. And your pen is ready to go. So to start it, you hold the button. There's 5 different levels. So 1 is low, 2, 3, 4, 5. You'll always go to 5. That creates the smoothest application on the skin. And then just hold down to stop. Make sure that you have some 2x2s or 4x4s when you're working with plasma. Safety glasses or some sort of eye protection is good. You want to put this over the end of a syringe to make sure it doesn't get in your eyes. So I do have my safety glasses, or my glasses here. Got about 3 minutes, so I'm going to go ahead and get everything ready that I'm going to need for extracting the PPP, the platelet poor plasma. So I like to use 3 5 ml syringes. You're going to draw about 1.5 to 2 mLs of PPP off of each vial before respinning and extracting your platelet-rich plasma. And lots of gloves. Change your gloves a lot. We're also going to get that hydrating serum ready. Also, we're going to add that, just 1 ml, to each vial or each syringe of the PRP. You want an 18 gauge needle along with your spinal needle to extract, and I'll show you how that is completed here in a minute. If you're going to be doing any injections such as eyebrows, eyelashes, hair, it does come with little needles also in the kit, so you'll have those ready. And this will help to activate the plasma whenever we get ready to harvest that, or once we get that harvested. Wait till it comes to a complete stop before you open. Push the button on the side, lift, and beautiful plasma. Keep them upright. So to vent the tube so that you can actually extract, you're going to use an 18 gauge needle, put into the top of the vial. Then you will use a spinal needle alongside. And this is where we're going to draw off 1.5 to 2 mLs of the platelet poor plasma from the top. We'll do the same to the next vial. And then we're going to set this aside. Again, this is drawn from the top. So we're going to set this aside. Even though it's platelet poor, it still is wonderful for cleansing the skin after the procedure. So anytime that you use the syringe with the plasma, make sure that you cover it, the top of it, to get the air out. Take both of these out. And then you'll still see some particles in here, so we're going to invert them. Just a few times, just to get all the particles activated. Then we're going to put it back in the centrifuge again. Make sure that you're balanced, that they're across from each other. This time we'll turn it down. We're just going to do a slow spin. I do 800 for 3 minutes. And press start. So we're going to be drawing off 1 syringe from each vial. Rather than contaminating, I'm going to go ahead and draw 1 ml of the hyaluronic acid serum. Hydrating serum is what I meant to say. This is going to make the plasma a little thicker for application. It helps to hydrate, tighten the skin a little bit. So just 1 ml. We're going to set that aside for the after serum. So again, that's our PPP. Our microneedling pen is ready, and actually we can set it over here on our workstation. I like to have some 2x2s just to help me hold the skin if I get, my fingers get wet or oily. Usually the longest part of the microneedling process is actually processing the plasma, getting the patient ready. Once you get started, it goes pretty quick. Now, as you can see, very gently turn about 5 times. Again, you're going to place the 18 gauge needle to vent the vial, the spinal needle to extract. Be very careful that you don't get down into the gel. And then repeat on the other side.
One of our participants asking, could you please repeat what will you use the PPP for?
The PPP will be used after the procedure to clean the face of any blood and just nourish the skin following the procedure. So at this time, we're going to activate the plasma. So this divider or this connector is in your kit, and you're just going to go back and forth about 10 times. I like to keep the same amount in both vials. Disconnect. Just get the air out, make sure that you cover the tip of the syringe. And again, wear eye protection. So these two now are the platelet-rich plasma, which we're going to microneedle in. Put these both over here on my work table. These are finished. We'll discard those once we're completed. And we'll come back to our patient. Again, whenever you're doing this part, make sure that you have on, even if we weren't wearing masks, make sure you have on